Assalamu alaikum warahmatullahi wabarakatuh. My name is Rakib Hassan and welcome to our final year project presentation. Our project ID 806D and our project title Steko Health Checker. And this project developed by myself and my friend Rakib Parves, and this project supervised by Dr. Nusharima Binte Saleh. Let's moving to our poster. We created our poster due to summarize our work for Steko Health Checker. Now we will present from here. Let's start with abstract. Remote health monitoring has never been more important than it is right now. Our newly developed mobile application is aimed to solve this problem by enabling remote monitoring of the COVID-19 patient as well as their health tracking of fitness enthusiasts. This app is called Steko Health Checker and it will allow to user to track changes the blood pressure level, blood sugar level, sleep hours and body weight over time. This application will store the health data entered by the user and display it as a graph. This app will also enable the COVID patient to update their daily health status, which will be evaluated by a doctor, and the doctor will take appropriate action based on that data. This app has some extra features such as reminder, a fitness quiz, share fitness tips and tricks, BMI calculator, and offers the health related products. Problem statement. The treatment of COVID-19 patients is hospitals require the uses of variety of medical equipment, personal isolated areas, doctors, nurses, and allied health personnel. The coronavirus spreads so easily between people that people are affected on a daily basis. Hospitals are already overloaded with a large number of patients and are running low of necessary equipment. In most hospitals, patients with serious health conditions are given the first priority. Home quarantine advice is given for normal patients, but when it comes to home quarantine, there is a significant gap in patient monitoring. The project objective. The objective of this project is to design and develop a mobile app that can track health vitals, blood pressure, blood sugar, body weight, sleep hours, calories intake, and alert users if any vitals are unusual and remotely help monitor the health of the COVID-19 patients. Significance of project. Doctors will get patients health data on one platform and analyze health condition in a short amount of time. By using this app, doctor can monitor any COVID patients remotely. It will save time and make the process easier. Before we started our work, we did some literature review and we select the three of them, which was the most important and helps our work. The repeat implementation of the COVID-19 remote patient monitoring program. They received alerts and messages from the patients. This technology has successfully grabbed the public's attention. Secondly, smart healthcare support for remote patient monitor during the COVID-19 quarantine. This advanced level observes patients by capturing several parameters such as the heart rate, breath rate, blood pressure, and blood pH level for these patients every second using the variety of the sensor. And remote patients monitoring program for hospital discharge COVID-19 patient. For this study, a health app was defined, a commercially available health or fitness app with ability of do self-monitoring. Tools used. We used Figma design tools for design and Flutter, Firebase backend, and various third-party libraries. Let's move on to our methodology. We choose Agile project management for this project because it is an interactive approach that allows the project teams to manage work throughout the development process. And we are using the Monday, which is a Scrum tool for Agile project management. Choosing an effective system development lifecycle can help with the development of a high quality software product that meets the customer expectations in delivered on time and on budget and contribute to the project's overall success. Here is our 6 steps of the Steko app development process. First of all, we generate our idea, then we analyze it, and after that we made our prototype, then we finish our coding, then we testing our apps, and now our apps is ready. My next presenter, brother Parves, will show how our apps works. Thank you everyone.
Rakib Parves. My metric number is 1737407. Now I will walk you through all the features of these applications. Let's get started. This is the first page of our application. User can get started by tapping this get started button. We have 3 welcome pages for new user. User can read through all the pages, or they can simply skip those pages. After this, login page will be come up. User can log in by using their user credential or using their Gmail account. And obviously for new user, we have creating new account option. User can create a new account using their credential or using their Gmail account. I already have an account, so I will log in using my Gmail ID. So this is the home page of our application. This page is containing all the informations about these apps and overview of all the features. At the top, we have user info, image and name. After that, there is a fitness quiz. After that, there is a update today's health status, which is basically health status form. After that, we have a BMI calculator. And lastly, we have all the overview of health data. For example, blood sugar, last night's sleep, calories intake, blood pressure, and heart rate. And this page is for accessing all the features. User can track heart rate. Here I'm doing 102. Add this data will be added to the database. And here I gotten one alert that my heart rate is not normal. It's telling me to take an appointment to healthcare provider. And also this data will be displayed in graph. After that, we have blood sugar. So we can enter blood sugar data, 6.5. And it will be added to the database. Next, we have blood pressure. So we can enter blood pressure data. 3. Next, we have count calories intake. User can food name, or for example, nasi lemak. So it's saying it's showing that nasi lemak is 400 calories. So I'll choose breakfast and add it. So this data will be added to the database and also displayed at the home page. After that, we have calculate BMI. User can calculate BMI, choose gender, age, height, and body weight. So at the end, it will display the result. After that, we have sleep trackers. So user can add bedtime, for example, 6 hours. So this data will be added to database and also displayed in graph. And lastly, we have tips and tricks. And we'll share tips and tricks on regular basis. User can read through this. And next, we have this page for statistics. This page will display all the graphs based on user data. So user can compare what are the changes. User will get a better idea about his health. Next is this overview part, and all the data will be displayed here based on user input, and user can track what is going on if any uh, anything is wrong, this app will send notifications. And lastly, we have a profile page. This profile page is containing information about the user, also uh, some information about the application, for example, privacy policy, and about the applications. And lastly, we have logout. Uh, that's all from us. Thanks for watching.